Hello, welcome back to my vlog. Long time no see. It has been maybe 6 months that I have not uploaded any videos. Well, because I have been busy. So busy. So today, I just wanted to share the story of our trip to Addenbrookes Hospital, which is in Cambridge, for the follow-up of Max's eyes, particularly his ROP, or the retina of prematurity. So today, we booked for an early train trip. So from our town to Cambridge, it takes an hour by train, and the appointment was set for 8:30 a.m. so that's a bit early. So we left the flat at about 7. We arrived there maybe 8, and then we had to find a way to get to the hospital from the train station. The problem was it was raining as well, so it was very difficult for us, especially with a baby. It's our first time to have this minute trip through public transportation, so it was a bit stressful, but we survived. The reason why we were referred to Addenbrookes from our local hospital here is because of Max's eyes. If you don't know, he was born premature at 28 weeks, weighing only 516 grams. And so when we were in NICU, usually the eye doctors will check the development of the eyes from 34 weeks, and then they will decide how often they will need to check then. So if it's after 2 weeks or after a week. In Max's case, it was actually all right around 34. Everything was good. 36 weeks, they found stage 1 ROP. So if you don't know, there are 3 stages of ROP: stage 1, stage 2, and 3, and there are different zones. But basically, as what the doctors that we've spoken to explained, so it's like the the nerves in the eyes, when they try to develop and to cover until the outer part of your eyes. So in premature babies, obviously, a lot of factors will affect how it will go with them. One main factor is the use of oxygen, because if they have too much oxygen, that could affect the development of the eyes or the retinas. And of course, for babies, they should be still, in the womb, to really develop it normally. But for premature babies like Max, it's a different story. But anyway, So from Norwich Hospital, we came to our local hospital when he was more stable, and then um, I the eye doctor in our hospital continued with monitoring his eyes. So the first time he said that it was still okay. It was still in stage 1. It's not progressing. It's not getting worse. However, just the recent eye check outpatient, when we went back and see doctor, he said that he found some progression on his eyes. Particularly, I think it's worse on his left eye. And after that, he referred us to like a level 3 hospital, which is then the Addenbrookes Hospital in Cambridge. So that's what we did today. We came there in the hospital. So before the checkup, what they do is they put eye drops that will help dilate the pupils. So in that way, they'll be able to really see properly, I guess. The thing is, this happened to almost all of Max's eye tests. Normally, they will just prescribe like 2 drops each of 2 medications. But in Max's cases, which they said because of the eye color, which is different, they always have to order an extra drops until that his eyes will be fully dilated. So that's also what happened when we went to Addenbrookes. At first, they give 2 drops in each eye, and then Dr. Elena advised to just give more drops. So they've given it to him, which he's okay. Max is okay with drops. I know, it's not really comfortable, but he doesn't really cry much. He'll just close his eyes and just sleep. So in the during the test, so in the clinic now, they had to use a clamp to open the eyes properly, and I didn't watch because I know that's gonna happen. And for me, I just I don't think that I'll be okay watching them do it to Max. Although my husband did, and he said he was really upset about that, but they have to they need to do it for him. But anyway, so Dr. Elena checked the eyes, did took some pictures of it as well, which she showed to us after the appointment. Okay ka lang? No.
Trying to be.
You're trying to be okay. Max isn't there.
It's a procedure.
And the results came back with a progression. So it's not stage 1 anymore. She didn't really specifically say what stage he is in, but he can see that it's not really developing as it should be, which is not, of course, a good thing, because if it's just left untreated, if there's no intervention at this point, I don't know, worse can happen. And so what she recommended is to have the laser surgery. As far as I understand, there are 2 interventions that can be done. The first is the injection, and the other one is the laser surgery. However, doctor said that because Max is mature, he's now 40 weeks to almost 41 weeks, so In his case, it's not the injection but the laser surgery. And so we are booked for the laser surgery this Friday. So today's Wednesday. That means it will be, oh, today's Tuesday. So we still have 3 days. So we have to be there at 7 a.m. Max will be under general anesthesia. Well, because of course for babies, they will not really be able to maintain and keep their eyes stable, steady, like the adults when they do laser surgery. So he has to go under general anesthesia, which is a bit I would say tricky for him, because he's got some problems with his adrenal glands. Also, because of the surgery, he has to fast. And we are also concerned because of his, again, adrenal problems. It could affect his blood sugar. During his NICU days, he had 2 episodes of hypoglycemia, even until the point that it was just 1.1, which was really, really scary, But Dr. Elena said that she will refer the case to the anesthetist, that's how they call it here. And of course, they'll be able to decide, what would be the best options for Max. But one thing is for sure, he has to undergo laser surgery to save basically his eyes. She also explained what the risks are. Of course, in every surgeries there are risks. She said that most likely, Max will have some eyesight problems, or like he'll be nearsighted, or there could also be some untoward complications, which happened maybe 3 babies in all of the UK, which is really, really, really small percentage, but still she has to, of course, explain us and inform us about the risk so that we are informed properly. So yes, that was all of it. Another, I think, issue for us is because the schedule will be at 7 a.m. and obviously we commute, so it's very hard for us. We're thinking of staying overnight on Thursday night. So we were waiting and hoping if there'll be like extra free like room or accommodation near the hospital that they can provide for us. But if not, then of course we have to book for a hotel or something, or ask some friends if they can let us stay. After the operation, Max will have to stay for a night, just because they're babies, they're newborns. They just he has to be monitored more intensively, I guess. So how I feel about that. So of course, both of us, my husband and I, are down and sad and worried. It's like, this journey is like never ending. Okay, sorry about that. So this is the continuation. I got a call from the community nurse about an appointment for tomorrow for Max. So I had to answer the phone. But anyway, so lastly, I was talking about my feelings regarding this news, this new ordeal for Max. So obviously, as a parent, well, my husband and I were both very worried, for Max. He has a very complicated case. He's got some problems with adrenal glands, with thyroid glands, And he has, you know, another surgery for his hernia. So we were just really sad that he has to undergo this again. Like, he's been through a lot, and sometimes I just ask, you know, like, why does he has to go through, and why he has to suffer, unlike, you know, just a regular baby. But what can we do? I think we're doing the best that we can for him, and all we can really do is to pray and to hope that everything will go well, that later on, you know, well, the good thing as well, though, because he's still a baby, so he won't really remember everything, unless, of course, if he later on watches these videos, so he will know. But for sure, he won't really remember how the surgery went for him, or the pain that he felt, you know. So I think that's just the good side of it. But overall, it gets tiring if you yourself is a NICU parent who has a baby in the NICU, so you understand what we are going through as well. And what we can do is really just to be strong. You know, our Max is a very brave and strong boy. He's been through a lot and he's still here. There are just some things, you know, some issues and problems that we have to monitor and intervene and treat him for, but it's everything that we're doing is for him, so he can have, you know, the best life. And yes, so that is all. I will update you guys of the surgery, of how we will manage with accommodation and everything. So just keep on watching our vlog, and thank you very much, guys. Take care, all of you. Bye.